Video pearl that I'm sharing is a technique that I've used in a lot of aligner cases. So as we know, when a tooth is not tracking with aligners, usually we're going to see visual evidence of that chairside in the form of a space between the incisal edge or the cusp tip of the tooth and the incisal edge or cusp tip of the aligner. There's going to be a gap. This represents lag, and usually it's lag in the vertical dimension, although it could be that a tooth was perhaps intruded. But let's say you're trying to extrude a tooth and the tooth does not go along for the ride, whether you've placed an attachment or not. Now you're faced with a situation where you see this gapping in the tray. Quite often, if you take a step back, you'll realize that perhaps the problem is that the short clinical crown that might be present is tougher for the aligner to grab, and perhaps the tooth doesn't even require the extrusion that you might have thought if indeed the culprit, so to speak, is the shortness of the tooth. And so if I get a gapping like this in the middle of treatment and I see that the tooth is worn or short, which you'll see sometimes with laterals that are short and worn, or in incisal wear cases on older patients, especially men, where maybe they're going to get veneers and they have very worn teeth. If they're going to need some lengthening on that tooth after treatment, in the middle of treatment, you can use my technique to fill the space between the aligner and the tooth, because if you think about it, the incisal edge of the aligner is a perfect bonding template. Also, what I've done is if I want to do a patient a favor and say lengthen a lateral incisor, instead of trying to extrude the tooth down in the treatment, I'll focus on just aligning the tooth. And then at the end of the treatment, the general dentist could lengthen the tooth, or I'll order a ClinCheck that will actually virtually extrude the tooth. That will give me an aligner that is longer that I can use as the same type of bonding template.
I've taken a scan at the end of the correction of some rotations, but I recognize now when I'm dealing with a short clinical crown, with these laterals especially, and so I chose not to extrude the tooth at all. I just focused on rotations. This allows the tooth to stay in the tray better. There's no reason for me to bring the gingival margin any further inferior, and I told the patient at the end of the alignment we can consider some sort of restoration. Now watch this. This is a virtual extrusion from a new ClinCheck. Invisalign might make you order 3 or 4 stages to fit with the default protocol, but this will give you a new aligner that you now have space. It's almost like the other case where it didn't track, but I've been proactive here. And now I have a perfect bonding stent. I fill the material, and there will be some excess that will bleed onto the other teeth. And when you peel this off, you can end up with a nice restoration that actually will require very little adjustment because your incisal edge anatomy is just lower down, but it's the same anatomy as the tooth.